This briefing will be on the record, and a recording will be sent immediately following to those who have registered. After the brief statements by each panelist, we'll open the floor for your questions. You can write a question in the Q&A box at the bottom. When you ask a question, please make sure to identify yourself, your name, and media outlet that you work for, and we will prioritize those questions for those who have identified themselves. Thank you so much. We'll start the discussion with Ghada Haddad. She's based in Gaza with Oxfam, and we'll let the panelists introduce themselves as well. So Ghada, the floor is yours. Thank you.
Thank you so much. And thank you so much for having me. This is Ghada Haddad. I work as Media and Communication Officer at Oxfam. You want me to go on? Okay. So actually, we are in Gaza, are desperately waiting for the moment that we receive the news of having a full and permanent ceasefire and to return back to our homes in Gaza City and North Gaza towns. But instead, what we have seen in the past few weeks, we have seen another wave of evacuation orders. This time was for the people in Khan Yunis city and in Burej refugee camp, with Israel declaring these areas to be no longer safe. What I can say that Gaza is already known to be the most densely populated place on earth, and now with the ongoing displacement, hundreds of thousands of people are seeking shelter in the northern parts of Al-Mawasi area and in Deir al-Balah city. Oxfam latest report, Waterborne Crimes, warns that if 1 million people sought refuge in Al-Mawasi area, people could have access only to 2.4 liters of water per person on daily basis. So the ongoing forced displacement always have little time for people to find a stable place to settle. There is no clear destination for people where to go, where to settle in. The situation in Al-Mawasi and Deir al-Balah is chaotic with insufficient water, scarce food, no sanitation, no paved roads, and no medical care. I grew up actually in this city, in Deir al-Balah, and I've witnessed the nightmarish transformation of this city from a place that is full of palm trees, which is known for, into a tent city that you no longer see the sea from the amount of tents on the beach road. I have never seen actually Deir al-Balah as crowded as it is these days. The area has become so congested that you can barely find any space or open space. Shoulders are usually touching the shoulders of other people while you walk, whether this person is a man, a woman, or a child. The displacement process is also expensive, requiring people to pack their belongings quickly and move quickly using pickup trucks if they are lucky, using or renting or share the pickup trucks with other people because they cannot simply afford the high price of such thing. Sometimes people use the donkey carts. I actually saw a woman last week. She was pulling a cart herself because she couldn't find a vehicle or any means of transportation to help her and her family to move from Burej refugee camp to another place, safe place in the dark of night. Being displaced with no safe place, with no shelter to take, no access to food, no access to sanitation facilities, no access to healthcare is unlawful. Being asked to evacuate multiple times and being asked to evacuate within minutes provoke a sheer sense of panic among people. I saw also another mother. She was tying her little baby around her body because she is afraid of losing him during this chaotic moment of being displaced. Now we also have an emerging sense of fear from diseases, from polio specifically, because it has been detected in sewage. I just wanted to say and underscore that polio is a disease that has been eradicated decades ago. And imagine it came back again these days due to Israeli restriction and on water and the damage they cause for the water infrastructure among Gaza Strip. We know that also what it means to have a pandemic, since our past experience with the COVID-19 tell us a lot. But the situation now is more difficult. Gaza's hospitals are overwhelmed with people who have been injured. Pharmacies ran out of medicine in all over Gaza Strip. I myself, I remember I navigated most of the pharmacies in Deir al-Balah and in South Gaza looking for a medicine for my mother for her heart condition, and I found it. And when I found it, it ran out of very quickly. We also see there is a widespread of diseases, of skin diseases like scabies and smallpox, and with other diseases like hepatitis A, which is exacerbated by the lack of water, by the lack of sanitation. Nowadays, we are in summer, and the summer heat and humidity of Gaza make everything worse and breeding more diseases. So all the day we are sweating with no access to showers, no access to hygiene products like shampoo and soap. I cut my hair short a few weeks ago, and I actually remember I was really shy to tell my friends and colleagues that I cut my hair. But after that, I figured out that I was not the only one or the only female person who cut her hair. I figured out that all my female colleagues and friends in Gaza cut their hair because there is no water and there is no hygiene or there is no shampoo. Whenever also I'm at work and Oxfam, women approach me and ask me whether we are going to distribute hygiene products, but these products are also restricted from entering Gaza. We know that food remains a priority, a top priority for people, but even that is coming to Gaza is coming with a very limited and small amount. So also we are here in Gaza, we are at Oxfam trying to address these challenges by paying daily workers to collect solid waste, but with the relentless bombardment, with the Israeli relentless bombardment and with no fuel, those people's job is being challenged and is made more difficult. People are forced to collect garbage with their hands while it is really hot, while it is really humid, and with no proper access to the needed tools and equipment.
Ghada, thank
In
you.
North Gaza is really escalating. And this is impacting negatively on the children and the babies. Friends and colleagues of mine who live in North Gaza, whenever I check on them, they keep telling me and asking me if I can send them vegetables because they don't have access to vegetables or fruits in North Gaza. So I can't believe that Gaza City is so close, yet it is so far. It become nearly impossible to access the northern areas of Gaza. In the past 9 months, I have seen many people who lost their limbs and who lost due to this war. I see lots of people and men who jump from one stone to another stone in order to avoid falling into the puddles of sewage or trying to jump over the destroyed building and the destroyed infrastructure and debris. So imagine somebody who has lost his or her limb, unable to find a proper transportation due to the lack of fuel, unable to find a proper health care, unable to find also paved roads because of the amount of destruction that is in the streets and because of this war. So we don't have access to the basic human rights. Our recent report at Oxfam, Water Crimes, show that people are surviving in 4.7 liters of water for all uses, for domestic use, for drinking, for cleaning, for everything. And I can speak volumes of what it means for a person to live on this. I can speak volumes when a mother is asking her child to not to ration in the water, because if we have water today, we might not have it tomorrow. Because if we have
Thank you so much. No, I definitely want to reserve more time to hear more about Oxfam's critical report on water being used as a weapon of war. I just want to allow time for others to come in, and we cannot imagine what you're seeing and living through right now in Gaza. Thank you so much for your powerful testimony today. Alexandra, Saieh, I'll turn to you from Save the Children. Please introduce yourself. Alex, can you hear us? Okay.
Hi, apologies. I had a technical issue. Hi, everyone. My name is Alexandra Saieh. I work for Save the Children, and I am based in the US. Just 1 second, I have a technical issue. Maybe go to the next person. I'm just having a technical issue.
No problem. Okay, Alex. Next, we'll turn to Dr. Javid from Médecins Sans Frontières, MSF, Doctors Without Borders. Dr. Javid just returned from Gaza yesterday, and please share your experiences over the last 8 weeks from what you were seeing on the ground. Dr. Javid.
Thank you, Hannah. Hello, everyone. My name is Javid. As I said, I'm the medical team leader for MSF in Gaza. I left yesterday. I thought I'd just give you a sort of short rundown of July, which is the second half of the period that I was there. I think it's really important to preface, just in case any of you were not aware, that when you're in Al Mawasi, which is the strip of beach, essentially in Khan Yunis, Rafah, where I was living, you can see the gunships, you can hear and see the drones, you can see and hear the Apaches. You learn to differentiate the sound of quadcopters from Apache gunships. You can see the missiles and fighter jets, and you can hear the gunfire all day. Just imagine that, and now listen to what I'm going to say. A quick rundown of July. The first 8 days of July saw 13 medical points, 4 primary healthcare centers, and 3 hospitals forced to close because of evacuation orders. One of those was my clinic in Gaza City, and the evacuation orders included blocks where my staff members were living. That also included European Gaza Hospital, which was the last big hospital in Rafah, and it brought pressure into Nasser, where I was working. Between the 9th and 14th of July, 3 of my colleagues had first-degree relatives killed. I was on the ward when my OT nurse, Fadi, I heard a wail, and his son had been killed in a strike at a school where they were sheltering in Nusayrat in the middle zone. He was the baby of 4 siblings, his only son. On the 13th of July, in Khan Yunis, my anesthetic colleague, Ahmad, I looked up from a mass casualty, which I was managing. I'll come to that in a second. And I said, why are you here? What's happened? And he'd heard that his house had been destroyed in that strike in the safe zone in Khan Yunis. His brother had been hospitalized, his nephew had been killed, and his nephew had a spinal injury. 13th of July, his brother is still on my ward. On the 14th of July, the next day, in Gaza City, up in that clinic, which was still closed, my nurse colleague, Mohammed, called me to say his 2 children had been killed. His last remaining child, a toddler, had his leg seriously injured. I could show you the pictures, and his wife was thankfully still alive. Between the 13th of July to the 22nd of July, we managed 4 mass casualties in Nasser Medical Complex. MSF, I was the medical team leader. We were, at the beginning of July, running a 47-bed trauma unit, which takes orthopedic trauma and burns and 2 OTs. We added to that enough beds to go up to 65 beds. That's relevant information. I'll come to that. In the first mass casualty on the 13th, which was in the so-called safe humanitarian zone, we received 189 injured and 555 dead just in Nasser. There were many healthcare workers in that mass casualty. They were the second wave of injured. They were ambulance first responders, and I dealt with them with my hands. The first child I saw was a 3-year-old girl with her thigh peeled off her bone. The second person I saw was a woman whose abdomen was out of her belly. The third patient I saw was a man whose calf was almost blown off. We were managing a boy on the floor during that mass casualty. He didn't yet have hair on his face, and we had to call him dead because you shouldn't do advanced airways in middle of mass casualties, but no one had the heart to do it, but we had to. Patients died waiting for operating theaters because the 8 operating theaters of Nasser that day were full. We were seeing patients on the floor. I had blood on my knees from kneeling next to them. The 4th mass casualty later, just 9 days later, was on the 22nd of July, where we received 265 injured and 73 dead. This was an evacuation order from the entire strip of the humanitarian zone itself, which involved 5 of my staff members, 2 of whom were crying on the wards while we were managing the influx. This was a mass casualty where there were many children. My first patient was a boy whose face was blown open. We managed him and moved on. My second patient was a woman who had shrapnel injuries and burns to her entire back. Her family was so pissed off at me for examining her in public in the red zone. But what could I do? I couldn't take a perhaps not burned patient to the trauma unit. The third was a man whose leg was blown off. The fourth was a girl who had a head injury, an eye injury, and burns to 3 limbs. The last patient I saw that day was a girl who we had to leave for dead. She was unaccompanied. She had no family. She was breathing. She had a head injury, but the system is overwhelmed. We didn't have enough blood and there were no beds. Nasser Hospital at that time ran bed occupancy well over what it should have. We have 365 beds in Nasser across all services. Just a few days ago, there were 550 patients in there. My unit, we added 18 beds and still run an occupancy of 120% after that addition. I want to just say that amongst all of that, for example, on July the 20th, was the day we discharged our last boy, our last patient from the Nusayrat Hospital rescue on the 8th of June. He had his left forearm amputated. He still had a left shattered femur and an X-fix on. He had such a severe brain concussion that he had memory loss and seizures. I wish you could see his smile, despite all of that. When I say that nowhere is safe in Gaza, nowhere is safe. Everybody has been herded into a humanitarian zone, so-called, where disease is rife. The top diagnoses in our primary health centers in MSF, and we run multiple, are all water and sanitation related. Diarrhea, scabies infestation, skin infections, and eye infections. We have children dying from hepatitis A in our pediatric unit in Nasser, where we have 3 or 2 patients on each bed. The occupancy is 230%. Polio itself is a waterborne disease. All of these are signs of inadequate water and sanitation. Whilst you see missiles above you, whilst you hear the gunships and you see the Apaches, and whilst there are no supplies, we have manufactured surgical gowns, we have manufactured auxiliary crutches, we ran out of ibuprofen and gloves. There wasn't enough fuel to pump water on the wards for a few days in the beginning of July. So the health system is crippled by a lack of fuel and supplies. It's endangered by evacuation orders that bring Nasser to within a kilometer of front lines. Forget about all the other hospitals that I can mention. And then it's overwhelmed by serial mass casualties that we simply cannot manage, where staff themselves are involved in the mass casualties. My physiotherapist was in tears because her family were calling her from the evacuation order saying, we can see tanks outside our building and we can't escape. And she was stuck at work and couldn't go to them during the mass casualty on the 22nd. Nowhere is safe. There's no supplies. The system is on its knees and it causes death.
Thank you so much, Dr. Javid. That was a really difficult to hear, and I cannot imagine what you all are seeing. I have no words. Dr. Yousaf, perhaps you could also add to what we heard from Dr. Javid about your experiences in Gaza and also shed light on the situation with the blood banks currently. Dr. Yousaf, over to you.
Thank you, Dr. Javid. I may have a hard time holding it together. So, you know, the Gaza healthcare system has been blasted back 50 years, right? So every hospital system, the infrastructure from a supply perspective, the type of care we wish we could provide other human beings is non-existent on the ground currently in central Gaza. And what I mean by that is there are many days, you know, reliving some of the moments that Dr. Javid just articulated poignantly, where I'm sure he felt the same way I did, even though I never spoken to him about it, where we stood between bodies on the floor of children in different stages of death and dying, and realized there was nothing we could do. There was only so much gauze and so many hands to place on bleeding limbs, so many tourniquets, and so many airways. And when you realize that what we've allowed to occur from a world and a society perspective of what's happening in Gaza is so inhumane and so, contrary to the values that we all internationally have accepted as meaningful shared morals and ethics around providing healthcare to people. These are the most vulnerable people on earth currently, under constant barrage and attack. And even when they come with their children dying in their hands and ask for help, we're unable to provide that for them. And so, I say all this, from an air-conditioned hospital, right, in America where I'm working today, never hearing the drones above my head and the continued barrage of explosions in the distance, knowing that would just mean another wave of patients coming in different stages of dying. I say that only having been there 1 month, and I think about the healthcare workers that have been there for 9 months, almost 10 months now, who only know this is their reality every single day. I knew that the day that I left Gaza was extremely bittersweet because I got a chance to go back to my family and my loved ones that were worried about me. But I was abandoning, and it felt that way, and it feels that way now, abandoning a group of people who aren't allowed to leave. They are herded like sheep and cattle into a middle area, not given the supplies they need to support their people, and then expected to keep their mouths shut and accept the ongoing trauma. Dr. Javid mentioned something important, which is the healthcare workers are also experiencing the same level of trauma, not just emotionally, but literally their homes have been destroyed. Most of the healthcare workers I spoke to had been displaced 4 or 5 times and were at our hospital, Aqsa Hospital, but they used to work at Shifa in Indonesia and the other places until those were evacuated or destroyed. And they were essentially volunteering, unpaid, many of them, because they had nowhere else to go. And they know that they needed to have some meaningful way of helping their people or themselves. And so they show up to work just to volunteer and help. And when the ambulances came 30 minutes after hearing an explosion in the distance, the first question asked was, what neighborhood was this? Which camp was it? Was it where my family was? Is it where my children are staying? And so just imagine when the ambulances come and you never know if it may be your own. And then the deeper reality of the Gazan people in the beautiful way they love each other, everyone is their own. It's a small 2 million, population where everybody knows each other in some way of capacity. So every single person, every single mortality beyond the normal thing is this is family, right? Every mortality. The last thing I'll focus on, because I know time I don't want to take too much time, is I'm a pediatrician by training as well, and we speak so much in the last few years within the medical literature about something called epigenetics and psychosocial trauma in the pediatric population when brains are still plastic, meaning in the very early portions of childhood, less than 8 years old, we think of the frontal cortex where all the wiring begins to come together. Under even one independent traumatic event may have permanent effects on the way a child will learn to cope and deal with trauma for the rest of their lives. The children we're talking about in these environments, I like Dr. Javid will never forget those who died, but I will, and I'm sure he won't either, I will never forget the ones who lived. And those were the children within the chaos, within the 200 people coming in different stages of grieving or dying, the children 3, 4, 5, 6 years old, wide-eyed, clinging to their parents or what's left of their parents or some relative or some family member or some adult, watching with wide eyes as they watch a family member or a stranger die from traumatic brain injury right in front of them, as they watch women scream in pain from burns that cover greater than 70% of their surface area. And I think, what will that do to that child for the rest of their lives if they live through this, if they survive through this, if we ever get to a point where this is ever opted to decide that this is unacceptable, right? And we stop this. Well, who will they be 20 years from now when they've lost all ability to cope because of the prolonged, persistent trauma and assault on their small, pediatric brains, and that's something that will live with me and will likely in the epigenetic research is the last thing I'll say. we know that those things, epigenetic research says that under immense trauma, that our DNA that we're imprinted with unravels in a certain way. It doesn't change, but it unravels in a way that exposes us to more significant risks to chronic disease, including things like diabetes and high blood pressure and stroke risk and depression, anxiety, PTSD. And that those changes carry to generations afterwards. And so as we allow, as a society, this to occur to this population, we're not just allowing the trauma to exist here in 2024, we are affecting generations of Palestinians.
Dr. Yousaf, thank you so much. I very much appreciate your stories and reminding us about the generational impact on children in particular. I just want to remind everyone, we do have a Q&A session coming up. We're running a little bit over. I'm going to turn to Alexandra Saieh from Save the Children, and then we'll hear from two other colleagues and then open the floor for questions. Thank you. Alex, over to you.
Thank you so much. Nearly 300 days into this crisis, more than 14,000 Palestinian children have been killed and more than 20,000 are missing. This includes children who have been separated from their families and are unaccompanied, children who are trapped under the rubble and presumed dead, children who have been buried in unmarked mass graves, and children who have been detained and disappeared by Israeli forces and held in unknown locations. In many cases, family are waiting in anguish for news that may never come about their children. And in other cases, children's identities can't be established either because there's no surviving next of kin or their bodies have been harmed beyond recognition, as my colleagues at the medical organizations mentioned. Children in Gaza are still being killed and injured in the most horrific ways imaginable. Their limbs are being ripped from them by explosive weapons. They're being crushed by falling rubble or struck down by preventable diseases. A staggering number of children in Gaza are losing their limbs and facing life-altering injuries due to the use of explosive weapons, and they do not have access to prosthetics or physiotherapy, and they can't flee when Israeli forces issue recurrent so-called evacuation orders. And foreign supplied weapons are playing their part in all of this. This past weekend, we saw attacks on schools in Gaza that killed children who were sheltering with their families who had nowhere else to go. And the attack in Majd al-Shams that left 12 children dead is another reminder that children are paying the heaviest price for the failure to reach a ceasefire. We're also seeing children in Gaza being detained and disappeared by Israeli forces. We don't know the exact number of children who have been detained from Gaza, but our partners report that at least that they have supported at least 49 children who were previously detained by Israeli forces in Gaza. These children reported physical abuse and interrogations where some said they were asked to strip naked and stand in extreme temperatures. During their arrest, their parents had no information about their whereabouts, and once released, children showed clear, visible signs of violence and ill treatment, including bruises, shock, traumatic stress, weight loss, and visible malnourishment. Some children reported being sexually assaulted, harassed, strip searched, and violently beaten. These so-called evacuation orders that are being issued are further endangering the lives of civilians. And Save the Children has had women come into our clinics having self-induced labor because they are so scared to go into labor while fleeing for their lives. We're hearing that families are also now returning to bombed out buildings because they have nowhere else to go, buildings that are unsafe and have not been cleared by explosive ordnance. Mothers are reporting that they're so starved that they don't have the nutrients to breastfeed their newborns. To speak a bit about the general aid response, I don't think anyone can say that there's been an improvement in the safety of aid workers in Gaza. The number of aid workers killed continues to climb now at more than 278 aid workers killed, most of them Palestinian. Attacks on so-called humanitarian zones are now the norm. Every month, we recognize that we and other humanitarian organizations continue to warn about the shrinking humanitarian space and the collapsing humanitarian system. And every time we say this, things get worse. But let's be clear, at no point in the last 9 months has the type any amount of aid entering Gaza been enough to meet the needs of the people. And in the last few weeks, we have seen intensified Israeli attacks in areas of Gaza where aid organizations are providing services, including in the Israeli designated humanitarian zone. And this is crippling any semblance of a humanitarian response left in Gaza. This, combined with the crossing points for aid that are largely often closed or dysfunctional, has had a drastic impact and impeded the ability to deliver life-saving supplies. Attacks on the humanitarian zones, on the so-called humanitarian zones, the never-ending evacuation orders, and the killing of aid workers, which our organizations documented over the last few weeks, is crippling aid delivery. The medical professionals on this call also mentioned the the illnesses that are widespread in Gaza. The aid workers are also becoming sick, and this is also crippling the aid response. At Save the Children, we have 17 pallets of temperature-controlled medicine still stuck in Egypt, and we haven't been allowed to transport these supplies into Gaza because the Israeli authorities are not allowing closed trucks and are requiring flatbed trucks, but closed trucks is what's required to keep the medicine keep the medicine from expiring.
Alex, I'm so sorry. Turn to the next speaker soon, but if you want to say one last remark, and then we'll turn to the next speaker.
I will just to mention that the recurrent relocation orders and so-called evacuation orders is also impeding aid workers' ability to access supplies. When so-called evacuation orders are issued, we then no longer have access to the warehouses in the evacuation orders zones. And this is also crippling the aid response. Setting up a humanitarian response is not like turning on and off a light switch. There needs to be some level of predictability, which no one in Gaza has. Over.
Thank you so much, Alex. Now I'll turn to Cristina Ribas with Action Against Hunger.
Thank you. I'm Cristina. I'm from Action Against Hunger Emergency Team, Nutrition Coordinator. I've been in Gaza for 9 weeks total since March. I've been in and out 3 times. Just very quick, because most of it has been mentioned by other colleagues. Prior to the 7th of October, acute malnutrition rates in Gaza did not exceed 0.8% among children under 5, according to the Multiple Indicator Cluster Survey from 2019 to 2020. Therefore, it was not the best resource allocation to treat and prevent direct causes of malnutrition, and for that to deploy CMAM services, and that stands for Community Management of Acute Malnutrition. And we were mainly working in food insecurity and water, sanitation, and hygiene sectors. At this present time, we're mainly supporting CMAM clinics, so that's the Community Management of Acute Malnutrition, as well as blanket feeding for children under 5 and pregnant and lactating women. And that is because children and women are especially vulnerable to malnutrition due to the additional nutrition demands that they have during critical periods of growth and development. And the importance of a healthy nutrition status is key for full development in childhood and to avoid potential complications during pregnancy that could put both the baby and the mother's life at risk. Maybe just as a personal note, being deployed to start and kick off programs on malnutrition in a context that this was not the case before is quite heartbreaking, and no one should face their country seeing this deteriorating situation. Unfortunately, in our programs, what we see and our data is showing is that it's not getting any better. We're starting to see worsening of cases, and this is due to malnutrition is multi-causal. So waterborne diseases is one of them, poor access to healthcare, between many other different factors. But just to mention best. Thank you.
No, thank you so much, Cristina. We'll have more time during the Q&A session to answer questions specific around the famine nutrition response, but it's very powerful to hear already the work that you're doing. Last, I'll turn to our final panelist, Jesse Marks from Refugees International, and then we'll open the floor for questions. Thank you so much. Jesse, over to you.
Thanks. I'll be brief so we can get to Q&A. But the spillover of the Gaza war right now is causing escalation far beyond Gaza. We're seeing extensive escalation in southern Lebanon and new waves of attacks in Iran, Syria, Iraq, and Yemen. We are on the brink of a region-wide conflict, and I don't think we should underestimate where things are going to go from here. This escalation threatens to deepen the existing acute and prolonged humanitarian crises. I'm going to emphasize prolonged humanitarian crises in Syria, Lebanon, Jordan, Iraq, and Yemen. These are areas that were already vulnerable prior to the conflict, where there is the potential for expanded airstrikes and aerial bombardment across the region. All of the parties to the conflict have failed to protect civilians. The consistent pattern of civilian harm is a powerful indicator that the spillover of violence will follow a similar trajectory, resulting in catastrophic civilian casualties and violations of humanitarian law. Currently, the region cannot afford new humanitarian crises or the deepening of existing ones. There are currently tens of millions of people already in dire need of humanitarian assistance, and any new forms of violence would exacerbate their vulnerabilities and undo any progress that has been made in addressing their existing needs. Furthermore, the challenging component of this is major cuts to humanitarian funding by donors are likely to severely limit the ability of UN agencies, humanitarian actors, to respond to a mass crisis scenario spanning multiple borders. Already in Lebanon, the war impact has been severe. 100,000 people have been displaced from southern Lebanon and 60,000 in northern Israel. An expanded humanitarian operation would overburden Lebanon's fragile stability and undermine the humanitarian community's ability to scale a new response to address new waves of displaced Lebanese, Palestinians, and Syrian refugees we would see. The challenge of this is Lebanon has sea to one side, Israel to the south, and Syria to the east and north. The domino effect of displacement would be acutely felt in Syria, where many would be forced to potentially flee. And for those who are unable or unwilling to go to Syria, and I'm thinking here of over 1 million Syrian refugees who refuse to return, the only option would be the crossing to Europe, an area that has garnished significant media attention and creates the potential for another large maritime movement of people. Meanwhile, in Syria, we will most likely see some level of attack. Previously, Hezbollah's presence and Israel's ongoing strikes inside the country will certainly escalate. We are at a point where Syria's humanitarian response infrastructure is fragile and hanging by a thread. In conclusion, we will see this expand. We can talk for a long time about this, and I think we can explore some of this in Q&A, but humanitarian aid workers must not be forced to turn their attention away from Gaza at a time where the needs in Gaza are catastrophic. As you've heard from other people on this panel, President Biden, Vice President Harris, and the administration must act to avert a worse catastrophic humanitarian disaster and should exercise its leverage to do so. They must do so. More specifically, we need a ceasefire. We need an end to the war. We need the pause, the ability to go in and scale up a humanitarian response to address these emergency needs. In addition to that, we need a halt in the arms that are being used daily to attack and harm civilians in Gaza. Until we have those things, it will be virtually impossible to address the current crisis inside of Gaza, much less address the spiraling conflict beyond it. I'll pause there.
Thank you so much, Jesse. So now we'll turn to the Q&A section of the media briefing. If you could please, again, as a kind reminder to journalists, identify yourselves with your questions in the Q&A box at the bottom of the screen. So our first question we have is from Dawn Clancy with Pass Blue. She said, Sigrid Kaag, the UN Senior Humanitarian and Reconstruction Coordinator for Gaza, in a recent press briefing with reporters, talked about a mechanism that's been created to fast-track, mainstream, and organize aid deliveries to Gaza. She says it's a tool to get approvals and have clarity and transparency around the denials and refusals. So from a humanitarian perspective, can you please share with us if indeed the mechanism is working, and has it made your jobs any safer or easier? And I'm going to first turn to Bushra Khalidi from Oxfam's OPT team. Bushra, over to you.
Thank you for having me. We cannot operate in Gaza without the United Nations and UNRWA. Let's make that very, very clear. So we support any mechanism that is supported by the UN to facilitate humanitarian access, the opening of land routes, So far, the UN and UNRWA and humanitarian organizations have been obstructed, which is what we've been saying for the last 9 months. Therefore, we're unable to do our jobs properly. And so Sigrid herself has not been able to probably do her job properly, since she has a mandate over the land crossings and only one remains open and another one is dysfunctional. However, there was something called the Gaza Reconstruction Mechanism a few years ago. And that ended up doing a tool that was facilitating the blockade and facilitating the restrictions on dual-use materials into Gaza, and was very much criticized by Oxfam at the time, even though that we were using that mechanism. It is just very important that any mechanism for the entry of materials and for access to humanitarian assistance into Gaza is not another tool of the occupation. Rather, it facilitates and works towards the end of a blockade in Gaza and an end of the military occupation through the stop of a halt of arms sales, plus the upscale in enormous amounts of humanitarian assistance and access. Thank you.
Thank you so much, Bushra. Jesse, would you also like to comment on this question?
Yes, thank you. So the mechanism has been set up. It's functional in Cyprus, it's functional in Jordan, but still not fully operational in Egypt. I think the point here, and to build on Bushra's very important points, is that this mechanism exists to monitor, but it also has an advocacy component. Because the mechanism sees what goes in, what doesn't go in, what is delayed, what is ultimately rejected or blocked, means that there is insight exactly into A, what's moving in, but B, why it's not moving in. And I think those are the key questions that this mechanism is particularly helpful in us getting to the root of. Why are certain medicines being blocked? Why are, as some of our colleagues here today said, gloves not being delivered? Why are the critical necessary items that need to be delivered into Gaza to scale the response and save lives fundamentally being rejected, blocked, impeded, or delayed? Those are the types of questions I think that we need to be asking of the mechanism, and that or generally representative needs to be more vocal about vis-a-vis the IDF and other actors. I'll pause there.
Thank you so much, Jesse. The next question we have is directed to the doctors on the call. It's from Sana Noor-Haq at CNN. Please, can you give a sense of the psychological trauma sustained by Palestinian healthcare workers in Gaza after 300 days of the Israeli military campaign? And how are they computing the very graphic injuries arriving at medical facilities while juggling fears for their own families? So Dr. Javid and Dr. Yousaf, over to you.
Thanks, Dr. Javid. I think you probably have a great thing to say about this too. The truth is there is no coping mechanism capable of dealing. There's no training. There's no preparation. There's no type of medical training that can prepare you for the level of trauma and the level of death and tragedy you're seeing every day as a healthcare provider. It just doesn't exist anywhere in the world. And so to deal with that for 9 months, if you're saying, how are we doing it? They're surviving. It's a surviving mechanism at this point. There is a ton of disconnected healthcare providers who have glazed eyes, moving between dead and dying to dead and dying, using their hands because there are no gloves, ripping through gowns, trying their best to triage. We dream of a triage process in Gaza, and it doesn't exist because when you're overloaded as much as they are, and emotionally burnt out as much as they are, there is no process you can put in place. And especially, like I said before, when it may be your own family members dead and dying. The one thing I'll say, and I'll let Dr. Javid take over because he articulates it really well, is I realized really quickly in the time that I was there, but the only valuable thing I could probably do was give the other medical healthcare providers some space to unload and to debrief, because they had no opportunity to do so. And the reason they don't is because every one of them is going through it. And so if you have, how can I say, hey, Dr. Javid, I had a bad day. I saw a kid die, which happens sometimes in healthcare. When Dr. Javid has seen 20 of those in the last 3 days, there's no room, there's no emotional space to even process and debrief so you can really get and provide the type of care that we want for the next patient. So that's all I have to say there.
Thank you so much, Dr. Yousaf. Dr. Javid, do you have anything to add?
No, I'll just second all that, really. He's put it spot on, Yousaf. There's no sort of post-trauma moment to start providing counselling for our staff, which we do, and we try for patients. So everything at the moment is just in sort of psychosocial support mode rather than full mental health care therapeutic mode. To go through that for 9 to 10 months, we're going to be looking we already are looking at an explosion in mental health issues, and as much as anything else, giving parity of esteem to mental health as well as physical health. This will be an enormous burden on the population and on the healthcare workers going forward.
Thank you, Dr. Javid. Our next question is from AFP in Jerusalem, from Chloe Rouvaille-Rolls. Can you please tell us about the situation of the state of the blood banks in the Gaza Strip?
Well, my experience just in the last 10 days was that, of course, the use of blood is high in trauma, but of course you also have maternity is usually the next highest blood usage in a hospital. Okay, so Nasser Hospital is the last major blood bank in the humanitarian zone. European hospital was lost. Al-Aqsa is functioning, but even the Ministry of Health usually says Al-Aqsa is barely functioning because it's been over 300% occupancy since I've been there. To say that we were down to just 2-digit numbers of blood units when the mass casualties started on the 22nd of July, it tells you something. If I was due to go to Shifa Hospital on a coordinated movement that morning and came off it as soon as I saw the evacuation orders anticipating the mass casualty at Nasser. And I happened to go back to base, and my laboratory supervisor called and said, we're going to run out of blood transfusion giving sets today. And if I hadn't taken the 150 that I had in the pharmacy on site, Nasser would have ruptured. It would have ruptured blood transfusion giving sets on the 22nd of July when we had 265 injured coming to the hospital. So that's the state of the blood services. We tried to run blood donation drives. We did one the next day, MSF, with the Ministry of Health at Nasser. But 10% of the donors, the willing donors, who are people from the community and relatives of patients, 10% of them had to be excluded because of anemia or being underweight themselves, which is a sign itself of the general state of the health of the population.
Thank you so much,
That's
Dr.
my
Javid.
experience.
Thank you. Our next question is from Isabel Debray of the Associated Press. Something that people I've spoken to in Gaza have expressed concerns about what is the impact of radiation from all of the explosives and missiles now on the ground and on the water supplies that may affect people's health as we're seeing the spread of diseases with infections and rashes. And it might be too early to really know the impact, but wondering if there's any initial understanding about this and the long-term health consequences of the explosions. So which colleagues would like to respond? Dr. Yousaf?
I can't speak to the long-term effects because we don't have the luxury of assessment, which is such a strange thing to say out loud. We can't assess the blood bank problem because nobody can count meaningfully because there's another explosion coming, right? We don't know what type of weapons are being used, except that we know that they aren't the typical weapons expected in a civilian population, because we were seeing thermal burns that didn't really make sense from a classic explosive. And I'm not a trauma doctor, right? And I don't understand military strategy or military weapons. And what I can say is that people were dying of full body burns without any other blast injury, which doesn't make sense unless the weapon was made to burn, right? And so the types of I didn't see radiation injury in the classic sense, because they may have just been typical burns or they may have been radiation. We have no idea. There's no way from a medical perspective you can make that assessment until there's people who are trained and capable of measuring those things allowed on the ground. And obviously the theme here is that nobody's allowed, right? It's an extremely limited group of people. There's very few international eyes allowed on the ground, and there's no doubt that's by design.
Thank you so much, Dr. Yousaf. So our next question is from Anna Vassar from People's Dispatch, and it's directed to Alex, Saieh, and to Cristina as well. Given the conditions in Al-Mawasi and other affected regions, how are healthcare providers trying to address maternal and infant health needs? And can you in detail give examples of the specific challenges and measures taken to deal with the malnutrition among pregnant women and newborns? So Alex and then Cristina, over to you.
Thank you so much. Look, there are a number of challenges. One is the sanitation situation in all of the IDP sites. The displacement sites are horrific. People are basically living amongst sewage and garbage in overcrowded conditions. In terms of the impact on malnutrition, there are mothers who are so malnourished that they cannot breastfeed. And because of the lack of clean water in Gaza, feeding children who are bottle fed, children who are reliant on formula, that's a challenge because the water isn't clean, and water is required to mix the formula. Mothers, including pregnant women, are not getting the nutrients they need to deliver babies safely and to breastfeed their children. There's also a dire shortage of medications, which other colleagues at other organizations have mentioned, and this also impacts pregnant women and women who have recently given birth. In June, Save the Children had a mother who was 38 years old come into our malnutrition center weighing 84 pounds. So that's an example of how horrific the situation is. Over.
Thank you, Alex. Cristina?
Yes. So Action Against Hunger is expanding both in teams and locations. So we're currently covering 24 locations. 4 of those are healthcare facilities, primary healthcare centers where basic services are being delivered, and we provide and support on the malnutrition treatment and blanket supplementary feeding. To tag along on some of the challenges that Alexandra has already mentioned, we are running mobile clinics because it's the only way we can ensure wide coverage. So trying to expand as quick as possible, which means that we are not every day on the same location, but we take turns and we make sure that we follow patients weekly. To be able to implement basic mobile clinics, what you need is cars, fuel, and staff to be able to deliver services. Fuel has been a main constraint. And it has not been entering Gaza sustainably, which has put humanitarian aid workers and their programs at very difficult positions at times to prioritize different types of activities.
Thank you, Cristina. Thank you so much. Our next question is from Anjana Sankar from the New York Times. And this is for Save the Children. Can you please elaborate on what you said about children in detention? How many of them are currently in detention? How many detained and have been released? And do you have an age breakdown? And also, who are the partners with whom you have collected this information? And just for the journalist information on the call, we'll be sharing Save the Children's report and other relevant reports that have been mentioned with you all following this briefing. But Alex, please come in.
Thank you so much for that question. We don't have the exact number of children who have been detained, unfortunately. What we do know is that our partners have supported 49 children from Gaza who were detained. Unfortunately, we cannot reveal the identity of these organizations due to safety concerns. And sorry, what was the last question?
Sorry, Alex.
Yeah,
and simply the age breakdown of the children that you're seeing who were detained.
And the breakdown, it's a range of ages, to be honest. Everything from young teenagers to it's a range of children. And we've heard these testimonies since basically not just in Gaza but also in the West Bank since October when things escalated. So children have been detained in Gaza and from the West Bank in increased numbers since October.
Thank you, Alex. So the next question we have is from Shireen Jafari of the World Radio. Some physicians who've recently returned from Gaza have reported seeing children with types of wounds that are consistent with direct gunfire and sniper fire. Can either of the doctors recall seeing those types of injuries on children?
What I could speak to real quickly is that what I did see, the middle area, a vast majority of what we saw were burns and explosive injuries related to bomb blasts. That's in the middle area. That's a vast majority of what we saw. And so what we did see a lot of, which isn't exactly your question, is we saw a lot of small targeted shrapnel injury. So what we did notice were these small, heavy laden cubes that I guess are probably a tungsten or lead that were in the bombshells. And we would see small entry wounds in children from these bomb blasts with massive internal injury and bleeding, because the shrapnel that's put in there is made to cause as much internal damage as possible, and cause as much, person death as possible, right? Human body injury. So I personally didn't see a ton of specific gunshot wounds for children, but maybe Dr. Javid has seen something to it.
I myself was working in the trauma orthopedic burn unit, not in the emergency room, and only managed mass casualties. So in that sense, didn't see single injuries. I did witness the sniper shooting of fishermen on the beach firsthand with my eyes. They were cast net fishing. One was shot in the neck and one was shot through the heart, clinical shots. We confirmed them dead and took their bodies back to town. This was on my convoy movement to the north in my first week, but that's the only sniper shots that I saw.
Thank you, Dr. Javid. This next question is for Ghada from Koi of the AFP in Jerusalem. Speaking of shrinking humanitarian space, can you talk a little bit more about the difficulties of managing humanitarian staff rotation? We've heard that it's more increasingly difficult to get foreign aid workers in to relieve staff, and because of the Rafah crossing being closed, Kerem Shalom, KS crossing being in active combat zones. Are there any new restrictions on foreign aid worker profiles or anything you could share about this? Thank you so much. Ghada, over to you.
Yeah, I can say that with the ongoing evacuation orders and with also striking for Al-Mawasi area, which Israeli claims to have to be a safe zone, people move from one place to another, like seeking shelter. And with this, we feel like the safe places or the safe area has been shrinking since the start of the war. Now, with the idea when the first mass evacuation order happened, most of the organizations started to have their operation sites in Al-Mawasi, and in Rafah city, because at that time it was like considered a safe zone. So now with the Rafah invasion and with the closure of Rafah, these organizations have to hold their operation and their humanitarian operation and activities on the ground because of these invasion and because of the evacuation order. So the idea is we are at risk of having our operations at hold because of the offensives, the ongoing offensives, because of the Israeli restrictions to the borders, especially for the fuel entry into the Gaza Strip. And many of our colleagues, the international aid workers who come to Gaza and who work in emergencies, not only in Gaza, but all over the world, for decades said that this humanitarian response and this humanitarian crisis is the most difficult and the most complex one. And with all the restrictions that Israel is putting in order to hamper the humanitarian activities on the ground.
Thank you so much, Ghada. Dr. Yousaf, over to you.
So as a healthcare worker, I've been on many medical missions. There's never been one as difficult to get to as the one in Gaza. The dates were consistently changed, often a day or two before the intended entry date. They would only allow 25 people in total, including whichever number of physicians or healthcare workers. The exit dates were always a mystery. You didn't know if you were going to be able to leave when they said you were supposed to leave. And again, right, just thinking about who's trying to go. These are physicians and healthcare workers all around the world who are trying their best to help people who are very vulnerable. And what they're doing is they're making it as hard as possible to commit time. I'm sure me and Javid are in unique situations compared to many physicians that wish they could have gone. But when the dates keep changing, you can't, have a normal job and a normal life when that level of uncertainty is purposely placed in the process. Every step of the way was delayed. Every step was difficult.
Thank you so much, Dr. Yousaf. We actually have a similar question to that in the chat. Yes, Dr. Javid, I just want to elaborate and then you can come in. The question was regarding the process of getting doctors in and out of Gaza, and is that still happening? How is it coordinated? And they said that there was an understanding that Palestinian expats weren't allowed to provide additional medical or humanitarian relief moving forward. Is that the case? Dr. Javid, over to you.
My experience in MSF is that of late, because of the system of getting international staff into Gaza, we're reliant, unfortunately, otherwise, on the United Nations system of moving people in from Jordan ever since the Rafah invasion. So, and the reduced number of seats on those convoys that have been allocated per organization has meant that just in the last 3 weeks, we've had to reduce our teams. And that means that I have to decide whether I bring in my intensive care doctor or bring in the water and sanitation manager. And in the end, we couldn't bring in our intensive care doctor. And when you've got children in beds dying, or you've got the entire population suffering from hepatitis, polio, diarrheal diseases, what balance do you have to make? I now will have a gap with my mental health activity manager because we can't bring someone in. We've had to reduce the number of people we have in because the mechanics of only having 2 people per rotation means that to be able to rotate the whole staff means that staff would have to stay 3 months or more. And with the insecurity, stress, constant tension, that's not really a viable working model. And I hate saying that because my Palestinian colleagues have done it for 10 months and will continue to do it. So it's this dilemma constantly. But the movement of staff has become a real issue in that, as I said, we have to reduce or change the services that we're providing accordingly. And there's constantly this prioritization and dilemma about what service we need to put forward or otherwise with the international staff that we can bring or cannot.
Thank you so much, Dr. Javid. I have one final question and then we'll close. This question is, how have cuts and efforts to diminish UNRWA inside of Gaza impacted the aid crisis and service availability? So for colleagues who'd like to come in.
Listen, I can't comment on that specifically, but I just want to bring forward the notion that people need to understand that UNRWA is the biggest health provider beside the Ministry of Health in Gaza. So when UNRWA is incapacitated, that is really, really saying something from the health perspective. The bulk of primary healthcare centers, the bulk of healthcare given at community level, the large proportion is UNRWA. And so at least from MSF perspective, we stand beside them in solidarity in that sense as the major health provider of Gaza.
Thank you, Dr. Javid. Bushra?
And just to add, I mean, most of us here as INGOs, we actually work through UNRWA. We carry out trainings through UNRWA. We use their shelters, we use their warehouses, we use their trucks. So we are, hand in hand with UNRWA. And just like as Dr. Javid said, we cannot operate without UNRWA, and that needs to be made very, very clear. Not just in Gaza, across the Middle East. So just to, we are in partnership with UNRWA for decades.
Thank you, Bushra. Jesse?
Thanks. And just, I think, to add a little bit more broadly perspective, like UNRWA also provides support for neighboring countries. Like people tend to forget, as there's debate around UNRWA's role in Gaza, that there are 2 million Palestinian refugees in Jordan who rely on UNRWA for critical support, aid, services, which has become a cornerstone both of the Jordanian government's ability to host and continue hosting this community. So when people think about UNRWA, it is Gaza. It is the backbone of the humanitarian support infrastructure, as colleagues said, but it's also that same infrastructure in neighboring countries that continues to support and provide for them day after day after day. So to remove that creates a fundamental regional humanitarian crisis, akin to the one that we're talking about, if we see the bleed over of conflict.
Thank you, Jesse. And Dr. Yousaf, I'll give you the last word and we'll close.
I think this speaks to a larger, I can't specifically to UNRWA, but the demonization of humanitarian aid workers within Gaza is unique to every other experience I've ever had providing humanitarian aid. To do so and to allow the continued doubt placed upon organizations that have functioned for decades across the world, providing aid for the most vulnerable populations, to put doubt into the mechanisms of how they do their work and the type of care they're providing, puts every single person on this call in danger, puts every single international aid worker in danger, and then puts every single individual civilian in Gaza in danger. It's unacceptable from every level.
Thank you, Dr. Yousaf. So just as we close, a kind reminder that please do not quote crisis action. Please do quote the briefers you heard today on today's call. We also acknowledge, in addition to the extraordinary testimony we heard today from humanitarian workers and medical professionals who've been in Gaza or are still in Gaza, we also recognize those who are in the room, the journalists who are also under attack every day, and our condolences for our Al Jazeera colleagues who were killed yesterday. But we encourage the journalists to do get in touch with us about their stories of what they're hearing on the ground. And we will share this recording promptly with all of the links to the reports that you've heard. Thank you so much for our incredible panelists and for those here today. Thank you.